Hi, I'm Dr. Howard Zucker, the doc in Docology. Chances are you know somebody who's using one of these new anti-obesity drugs and perhaps raving about the results. These GLP-1 receptor agonists, as they're medically called, like Ozempic and Mounjaro, were created to treat diabetes, but they're also helping people lose weight and lower their risk of heart disease and stroke, kidney disease, even dementia and addiction. So a miracle drug, right? Well, not so fast. GLP-1s have not been on the market for that long. And so we don't know the long-term impacts. And now a study in Nature Medicine showed that there's a increased risk of developing arthritis and a potentially deadly condition called pancreatitis, which is an inflammation of the pancreas. So our topic of investigation today is what's the skinny on these weight loss drugs, and how safe are they? Well, we've got the perfect guest to discuss that question today, Dr. Judy Korner. She's a professor of medicine at Columbia University. She's the head of the Weight Control Center at New York Presbyterian Hospital, and she's the chair of the American Board of Obesity Medicine. So, Dr. Korner, I am thrilled you're here. Thank you for coming on the podcast. And let's start with the following. You care for many patients with obesity and diabetes. You've seen therapy as once viewed as transformative. They come, they go. Tell us a little bit about what you think makes this latest class of drugs so promising, and how do they tie into the management of obesity and diabetes for that matter?
Great. Well, thank you for having me. This is truly a very important topic that I'm sure is of interest to many, many people given the current states of obesity in the United States. Weight loss medications have been around for a long time, since the 1940s, and they've kind of had a bit of a sordid past. There are some that were effective and were taken off the market because of various side effects. We've been a little kind of reluctant when a new medication comes on board. Well, what's happened with these medications is that we find, yes, they're very effective, but in most instances, they're also very safe. You just have to know when to use them, how to use them, who is the right person, and if side effects do come up, how to deal with them. In that regard, it's very, very exciting because they haven't been out that long, but remember, as you say, they first came out as diabetes treatments going back 20 years almost. So millions of people have taken these medications.
Can you share a little bit about how they work? Because a lot of people say, I'm taking this, it works. And so it'd probably be good to just get a little bit of a background, how they work, how they're taken. Because I did hear that there are new ones potentially coming out that may be a once a day pill version. So I wondered maybe you could tell us a little bit about that.
Sure. Well, you have to think about, how do we know when to stop eating? Okay. Right. So you have a pizza in front of you. Are you going to eat one slice, two slices, three slices? You know when to stop eating because the brain is telling you when to stop. If you relied on mechanical issues, you would just eat and eat and eat and eat, until you really couldn't stuff any food down anymore. So we have a hormone in our body called GLP-1. It's made in the intestine. When we eat and food gets down into the intestine, the cells sense that there's food there. They release GLP-1 that goes to the brain into so-called appetite centers and tells the brain there's food in your gut, you should start feeling full. So we get the sensation of fullness and we stop eating.
So a question about that, because 70% of Americans are either overweight or obese. Do our bodies actually have a set point that will naturally return to? Because some people will say, well, I'll have a slice of pizza, or I'll have 4 slices of pizza. Mine is sitting in the refrigerator for dinner tonight. So I'm just curious as to whether they sort of say, well, I have this weight and I'm going to eat and I'll lose a little weight, but I'll come back to that set point? Or is that not really?
Right. It's you've hit a very, very critical point. Many people, many of my patients have told me, I've lost weight and I've regained weight multiple times in my life. What happens is that each individual has sort of their own kind of set point. What that set point is in part determined genetically. We don't fully understand, why each person has a given set point, but the body has a very long memory and wants to keep you at that set point. So let's say you go on a diet, you lose 10% of your body weight. You're 200 pounds, you lose 20 pounds, but you still have more weight to lose. But the body now says, oh my God, there's less fat. I might be starving. We were not, growing up in evolutionary wise with McDonald's around the corner. So, as a way, as an instinct, the body says, I now have to protect my body fat. Otherwise, I'll become infertile, I'll die, and there goes the species. So, what the body then does is it makes you hungry. And it says, you go out, you find food, you hunt food, you get that food. It also lowers metabolism. It's like you're in a state of hibernation. So now, even though you're eating less, your body is burning less. So here you are, you're trying to keep off those 20 pounds, but you're miserable, you're hungry, the food that you're eating just doesn't get burned. And you just can't keep that up forever and ever. And the weight tends to go back to where it was.
Well, these fluctuations, are they a problem? I read an article about Tom Hanks, and he was talking about, because he mentions he has diabetes. And in one of the articles, he made a comment as to whether somehow it was related to his weight changes in some of those movies. We had to gain a lot of weight or lose a lot of weight in Castaway. Is there a problem with going up and down like that as related to your health and particularly diabetes? Or is that, and will these medicines help that, prevent that?
Right. So we sort of call it, yo-yo cycling, yo-yo dieting, whether long term, if that's detrimental. It may be that with years and years of doing that, your metabolism is a little messed up, and it does slow down, making it even more difficult to keep the weight off. And you had a question about diabetes. What the question?
Right. My question was, if you have all these fluctuations in your weight, could that trigger diabetes? Would that be one of the triggers that could happen by going up and down?
Yeah, no, we don't think so. If anything, at least with the periods when you've lost weight and your blood sugar is under better control, that's actually a good thing.
Got it. Right. So one of the other things I've noticed over the years is that different medications surface, like the statins for cholesterols and the blood thinners for potential clots for prevent you from getting a stroke. Antidepressants. Are these GLP-1s the next set of class of drugs that people are going to just turn to and say this is the hottest thing on the quote on the market and think that they should be on those?
Um, I've been treating people, for weight loss now for over 20 years. And these drugs are, some patients say, this is a miracle. For the first time in my life, I actually feel full. I know what it's like to eat something, feel full. Some people talk about food noise or food chatter that kind of it makes the mind not think about food all day, and that is also a relief. um, I think that when we're looking at all the diseases that are caused or worsened by obesity, if you can use a medication to help you not just lose weight, but keep the weight off in order to improve your health, that is a wonderful thing. So I really do see the availability of these medications as kind of a new era.
I'm going back to that statin analogy.
Mhm.
The people said that you should be put on statins. The cardiologists will say that because they want to prevent problems down the road. Is it possible that, given how these drugs are helping with heart disease, and I mentioned at the beginning, addiction and other medical problems, strokes, is this one of those drugs where in 10 years from now people are going to say they should be on a low dose of these GLP-1 receptor agonists to prevent some of the other problems that may happen 15 years down the road?
Right. So I think you have to take it down to the individual. Um, first of all, the studies where the GLP medication prevented death, hospitalization, heart failure, stroke, those were in people who were a high risk population. Um, they already had a history of heart disease or stroke, right? So we know in that population, these drugs really, really should be strongly considered to be used. Whether a person who is otherwise healthy, um, you know, whether they should be using this medication to prevent something, um, that we're probably not there yet. Um, there's also risk benefits. We haven't talked about the side effects of these
Right.
medications. So if you're going to take a medication that may cause side effects, you have to determine, is this medication really for me?
Right. So let's talk about the side effects, because everyone wonders about what are the downsides of taking medication. Can you talk a little bit about the concerns? I mentioned a little bit about pancreatitis and arthritis, but maybe you can expand on that.
Sure. These medications are overall incredibly safe, but you have to know how to use them and if you have any contraindications. The biggest complaint about the medications is the nausea. Some people get really horrible nausea, vomiting. It can be either diarrhea or constipation. Certainly, I've had a couple of patients whose diarrhea was so bad that they had to go to the emergency room for intravenous fluids. Um, so, that's always a possibility. Now, does everyone get side effects? Absolutely not. There are some people who take the medication and they're losing weight and they're fine. So you don't know who's going to develop which side effect. The other risks of like pancreatitis, the risks are very, very, very low. I mean, there is a slight risk of pancreatitis, also gallstones,
Mhm.
gallbladder disease, um, that can occur. Um, so you have to weigh the benefits and the risks when you're taking them. I would say, with regard to side effects, it's really important to go to someone, a healthcare provider who can work with you through the side effects. This isn't the type of medication where you're given a prescription and a doctor should say, I'll see you in 6 months. Okay, the medications are started at very low doses, and that's to help your body get used to the medication. And then periodically, usually every 4 weeks, you should be assessed whether
Mhm.
you have to go to the next dose. If you do it that way, if you do it slowly, the
Right.
chances of developing serious side effects are really diminished.
Well, it's like anything, any medication, right? You start something, you want to monitor them for a while to be sure something is not, some adverse event is not occurring for them. So
Absolutely.
no different with this. Some people seem to be taking this just to lose a couple pounds because they think they'll look a little better. How and they may look a little bit better. But the question is that how is that a way to use these medicines or not? Or is that a risky approach? And what are people doing sort of on the in not talking to doctors, but sort of getting these medications from other sources?
Yeah, well, it's sort of like the Wild West out there right now with these medications. First of all, in our practice, we really don't prescribe the medications unless we think it's medically
And
indicated. Okay. And there are certain criteria that for which these, medications are improved. Your weight, your body mass index has to be a certain, you know, uh, at a certain level, whether you have health conditions related to your weight. So that's really should be assessed. If you want to take the medications to lose some weight for, your son's wedding, that is not how they should
right,
be used.
right,
Also, when you stop the medications, the weight is going to come back. Um, with regard to what's going out there, you could search this medication and all sorts of sites will pop up. And, you can get this drug for this amount or that amount. The reason that's happening is because the medications are very expensive. Um, they can be $1,000 to $1,200 a month. Um, Insurance coverage is very spotty. Some insurance does cover it, some doesn't cover it. And Medicare doesn't cover medications just for weight loss, they'll cover it for diabetes. Medicaid doesn't cover any weight loss medications. So people are really desperate to, lose weight and get healthy. So they go to these other sites. Um, Whether those sites are producing legitimate drugs that are safe is questionable. There have been quite a few warnings about what you get if you go onto these sites.
Expanding on what you mentioned before about once you come off the medicine, you'll gain the weight back. So it's really part of a bigger management plan, right? It's not the medicine is one part of it, but all the other things that go into the management of obesity. And you mentioned, that we talked about the set point and genetics, but maybe you could talk a little bit about how this is just one
Yeah,
component of a strategy that one has to undertake.
yeah. So this is a topic that I spend a lot of time on with my patients because no one wants to take a medication forever.
Right.
Um, the thing is that the medication will work as you're taking the medication. Um, if the medication is changing signaling in your brain to make you feel less hungry and more full, that will help you lose weight. The minute you stop taking the medication, those signals are going to revert back to where they were. And every study that's been done so far will show it's very, very likely that weight will be regained. Whether you regain some of it, all of it, it's unclear. It depends on the individual. So once you start on the medication journey, you really have to know it's very likely this is going to be long term. I just want to make one analogy
Mhm.
because people really get very upset about this. But if they're on a drug for like blood pressure, and they were prescribed the medication for hypertension, and then they go back and the doctor says, well, your blood pressure is normal now. You're not taking off the medication,
Right.
right? What's going to
Right.
happen if you stop the medication?
The prices go right back up. Right.
Well, this is no different.
Right. Right, exactly, exactly. But then it goes back to what we were talking about before, is that we'll manage your hypertension by doing other things, right? The exercise and eating well and trying to deal with other things to control any of the other risks.
Yeah.
One of the things I wanted to ask you about is why, how, and why is this medication helping on other issues like
Mhm.
cognitive decline, addiction, inflammatory bowel disease? How is this one medication um, being beneficial for these other problems? And and maybe the science behind that, or do
Yeah.
we know? Yeah,
So, well, a lot of it we don't know. For example, the biggest thing is, as you mentioned, the 20% reduction in deaths and
right,
hospitalizations and heart attacks
right,
and
right.
strokes. A lot of that is related to the weight loss. Um, but not all of it. There is some component of this medication that is doing something to the heart or the vessels that is independent of body weight. What it is, we don't necessarily know. So, one of these medications, the latest is a combination of GLP and GIP. It's
Right.
another hormone called a dual agonist, very similar in action, but that was recently approved for the treatment of sleep apnea. Um, so that most likely is due to the weight loss effect. Um, it's been shown to improve pain from arthritis. The other things that you mentioned are really under study now, like for cognition, maybe prevention of
Right.
dementia. That we don't know, but it may be independent of weight loss. We think that these medications affect inflammation, and inflammation is sort of the driver of a lot of negative health issues. And that's what we think is going on.
You think it ties back to glucose and your sugar levels as well? I mean, given how it helps with diabetes?
Um, Certainly, if your glucose levels are high, definitely that's part of it. But um, I think we're seeing health benefits in people who don't have diabetes and have normal glucose metabolism. So there likely is effects, an effect that's independent of glucose.
I just want to, for the audience and those listening, so the 20% reduction, there was a New England Journal of Medicine article from 2023 that showed a 20% reduction in cardiac death and heart attacks and strokes as a result of people who were on this medication. They did a large study with 17,000 people, just so people get a little bit of the background on that. We want to go to our audience and our subscribers to have their questions. But before that, what would be the three takeaways that you would have today for those listening regarding these GLP-1 receptor agonists, and what should they be thinking about on that?
Well, the one thing is that in general, it's a class of medication that is very safe, is
Mhm.
very effective if used responsibly, and is prescribed by someone who knows how to help you through them.
Good.
Another thing is that um, people's responses vary, okay? So that we don't know in advance how much weight you will lose. It's very individualized. So don't be in a race with your neighbor, your spouse, your best friend. Think of the health consequences and just go your
Right.
independent path. And the third thing is that don't rely just on the medication. Think of also changing your lifestyle, working on your balance, working on your movement, and working on your nutrition. Make sure you're getting in enough protein. Um, there's a lot of talk, I'll say, about losing muscle. And if you have healthy nutrition and exercise, that will help. So, those are the three main things.
Well, that is great, and these are critical points. We're going to make sure those get out there. But we've reached the point in our show when we turn to our most important guests, which are our subscribers. And I know they have a lot of questions, so I want to tee those questions up. And as we do that, I just want to make a quick point that it's important that on these podcasts, the information you have that we provide to you are for informational purposes only, not in place of a doctor's visit. Although Dr. Korner obviously, sees a lot of patients and she's provided an incredible amount of information. But you should listen to your doctor about individual medical recommendations because they know your medical history and they've been following you for a while. So let's turn to our subscribers and find out what their questions are, and then we'll see if we can answer those. Kat?
Well, I'm going to kick us off and give everybody a
Okay.
chance to drop their questions in the chat, and we'll have you turn on your camera and mute yourself, and you can ask Dr. Z and Dr. Corner your questions live. But my question was, who would be sort of like the ideal candidate for these weight loss medications? Is there some sort of like specific BMI or health condition that makes you more eligible or a good candidate?
Yeah. So BMI, for those who don't know, it's body mass index, and it's basically a person's weight, but adjusted for their height. So people who have a BMI of 30 or above, they would be candidates for the medication. If your BMI, though, is 27 and above, and you have health conditions that are maybe caused or worsened by obesity, such as diabetes or sleep apnea or arthritis, high cholesterol, hypertension, then you can be a candidate for these medications. So those are the guidelines that we use.
Okay,
Great.
that's
Perfect.
fantastic.
Thanks, Kat.
So I'm going to go to Miss Julia, and she has a question.
Hi, Julia. How are you?
Hi, how are you all?
Great.
My
Great.
question is, one of the side effects of these medications could be constipation, as you said earlier. And so, the recommendation is increase your fluid, increase your fiber. And if that doesn't work, then, stool softeners on a daily basis. When you reach a certain age, is it wise to have to resort to stool softeners every day?
Great question. And constipation, yes, can be a very, very troubling issue. So as you said, I'll just say hydration is important, increase fiber, stool softeners. We then resort to things like maybe things like Miralax, that might help bring the make the bowels move. I think you have to weigh the pros and the cons. There are no long-term negative effects of using stool softeners or other agents if used wisely. If you start developing profuse diarrhea and overusing them, then that is a problem. But if you're using that and now you can move your bowels on a more regular basis and you're getting the health benefits, then it's okay. But definitely bowel movements do need to be monitored, and you may go less than usual in mostly because if you're eating less, there's going to be less that comes out. But if it's to the point where you haven't moved your bowels in days, then that's a problem.
And Julia, I'll just chime in a little bit, that if this is a new symptom separate from whether you're taking the medications, you should ask your doctor, because there are other things that cause constipation that you may want to be evaluated for, and not just say, well, it's because of this medicine. Could be the medicine, but just to be safe, on those things.
Thank you.
Not a problem. Thank you, Julia. Kat, who else do we have?
We had another question from someone in the chat, but they can't get on camera. So I'm going to ask the question.
Okay, sure.
But I think you mentioned a little bit about this before, but the question was basically, you can use GLP-1 medications to effectively lose weight, but you could also possibly end up losing muscle mass instead of body fat. Is there a way to avoid that sort of side effect, or is there something that you can do to not lose the muscle mass
Right.
and body fat?
Sure. So any sort of weight loss, you will lose both muscle and fat. So this isn't unique to this medication. Um, but yes, some of the things that you can do to minimize the loss of muscle is to make sure there's enough protein in your diet. Okay. So perhaps even seeing a nutritionist just to evaluate your diet would be very important. The other thing is to use your muscles. Okay. If you don't use your muscles, they're just going to weaken and atrophy. If you use your muscles, you will keep them stronger. And you don't have to all of a sudden become, a marathon runner. You can take where you are and then work from there. So simple squats you can do at home. You don't need a gym membership. You don't need fancy equipment. You can do that at home. Um, So-called what we call resistance training, resistance exercise. Those are important. And you can go on and get like little 10-minute videos on the internet if you put that in. Just simple things. So by doing some of the resistance training, make sure you're getting in enough protein, you can minimize that muscle loss.
Okay.
I should say also, I'm sorry, but people talk a lot about muscle loss.
Mhm.
But that's not always a terrible, terrible thing, because if you're overweight, you probably have more muscle anyway. It's functionality. Okay. So even though you are losing muscle, but you're now able to function, you're now able to walk the few blocks, whereas before you couldn't, you are now developing healthier muscle. And that's often lost in the equation.
Thank you, Kat. Before
That
we
feels like
jump
a
on the
very
net,
good point.
yeah,
So Cujo 30, I hope we answered your question.
Kat, before we jump to the next person, you mentioned about diet, and it made bell rang in my head about your microbiome and the gut bacteria that we have, and what we eat and how that impacts our weight. Maybe you could talk a little bit about what's in our gut and how that ties back, because they always say that the brain and your stomach are sort of, they talk to each other. So maybe you could talk a little bit about that.
Yeah, well, there's definitely what we call a gut brain axis. And the one is how I said that's how the GLPs work
Right,
to,
right.
they're
Send
talking
a
to your
message back, yeah.
brain. Yeah. The microbiome is very, very confusing. And we don't know a lot about that. Clearly, people, who have excess body fat have usually a different type of microbiome, but it's unclear if that is the cause of the weight gain or consequence of the excess fat. Um, we know in mice, if you take the stool from a skinny mouse and put it into a fat mouse, the fat mouse will start to lose weight. Um, most people aren't mice, so we don't know if
Right.
that works. It probably doesn't work. We just don't know enough about the microbiome in order to use it like therapeutically.
Got it. Got it. Yeah, there's some interesting, a lot of research left to do on that.
Oh, yeah.
Probably fascinating. Fascinating. Kat, who do we have next?
So I'm gonna bring up Miss Anna. She has a question for you guys.
Hi, Anna.
Hi, Dr. Zucker. Hi, Dr. Corner. Thank you for this. I'm really glad you asked the question about the microbiome, because I just watched this great documentary on Netflix called Hack Your Health, The Secrets of Your Gut. And they talk a lot about the mysteries of our gut health and all of they talk about that mice situation as well. So that's really interesting. My question about is about how do you handle a patient who's losing too much weight or not eating enough?
Yeah.
Great question.
So,
Great
yeah,
question.
we definitely want to lose weight responsibly. And we don't want people to become undernourished or malnourished. We just really decrease the dose usually. So these medications, you start very low and then you just increase accordingly. But if someone is losing too much weight too quickly, you just go back on the dose. And then let's say they've reached their goal and don't want to go any further, you could change and use a different dose for weight maintenance, um, and do that. So usually it's really controlled. Um, I haven't run into a situation where if someone is using the medications and they fit the criteria for the proper use of the medications, where we run into like runaway weight loss. You just really adjust the medications. And then, yes, you need to make sure that what you're eating is nutritious. Losing weight and eating just cheese doodles all the time is not necessarily a good thing.
Yeah, that's a good point.
Anna, did you have another question?
I think I was going to ask because
Yeah,
we
sure.
talked a lot about protein, and if you, Dr. Korner, had a favorite protein.
Ah, no.
Well, I think it's very, very important, and this is what we do in our practice, is that people should be eating what they like. Okay. A lot of times why diets don't work is you trying to follow something and you can't stand half the stuff that's on there. So I always begin with, what do you like to eat? Of course, lean proteins are what we think the best. So fish and chicken. If you're a vegetarian, try and get the proteins, tofu or from beans. Pork is relatively lean, and red meat is not like horrible, the worst thing in the world if it's taken in, not in abundance. So I would say, cheese is great, yogurt, that's great, eggs. So there are a lot of protein sources. Try to have protein with each meal. That's also important. And for some patients, let's say they don't like to cook or just, have a very busy lifestyle, you can use some protein shakes. There are ones out there that are very good that don't have much sugar in them. And there are so many out there, you could usually find one that, the taste is okay. So we do, recommend to use some as meal replacements for some people.
Awesome.
Is certain, just as another follow-up question on this, sometimes as people age, their appetite goes down, and particularly someone's older, living by themselves, they're not up for cooking a meal, and the next thing you know, their protein, their little protein shakes are not a bad thing to get
Yeah.
a little bit extra weight on them, right? So that's one of the things I've seen just from my own relatives, or my own mom. Well, we have other questions, so
Thank you.
read
I
my
appreciate
question.
it.
Thank you, Anna.
Thank you.
All right.
Bye-bye.
Well, I'll just chime in again because I had another question. You were mentioning about proteins and appetite. It seems odd that sometimes people just have a craving for something, whether it's salt or sugar. Is there sort of the science behind that? Or is there something going on that your body is basically saying, I need those potato chips, or I need that, candy bar? Or is that just, your brain saying that's what I want?
Right. So what we call that is physiological hunger, and where your body really needs certain nutrients. And there's the non-physiological hunger, like you walk by a bakery and like there's this gorgeous, pie sitting in the window, or a smell, and all of a sudden you just need that. So that's not physiological hunger, and that is a different part of the brain. Um, so there are parts of the brain that are reward centers, parts of the brain that are like addiction centers, and that's very different. And there are some people who do. We always talk about food cravings in our practice. Some people crave pasta, some bread, some sweet, some savory. And usually it's not out of some health need that your body has. So to address that, we usually then incorporate behavioral modifications, like maybe that's a trigger food and you cannot have it in your house.
Right.
Or maybe you can tell yourself, I will have it once a week on a Friday. Or, we talk about those things, but cravings are important. Interestingly, cravings do change in a lot of people with the GLP medications. There's a lot of talk about a decreased desire for alcohol. And these are just all things that we know from experience using the medication. And that's not in people who have alcoholism. That's just people who maybe normally might drink, a glass of wine or two with dinner. Now they, I don't really feel like it. And that's effects on the brain.
Well, I usually look at a menu and see where the mashed potatoes are, and then I decide what's going with the mashed potatoes. So I guess that's my craving there. Kat, who else do we have? Okay.
I'm going to bring up Miss Ronnie. She has a question.
Hi,
Dr.
Ronnie. How are
Zucker.
you? Hi.
Good. Hi,
You're an
Dr.
Ironman champion there, I see on
Yes,
the jacket.
I have a lot of issues with food. So I basically use it as fuel to do all the things I like to do. So I think that my question is a little bit broader in terms of, when patients are using this medication, how do you talk to them about body image and during treatment, after treatment? And then my other question is, if you are a person who really is suffering from obesity, does this mean once you go on it, you're on it for life? So the first part is about body image. The second part is about life.
Right. So the first part about it, a body image, is very important, and also eating disorders, which we haven't talked about. So we want to make sure that you're approaching this in a way that's going to improve your health, not worsen your health. We talk about weight loss goals. So if a patient says to me, if they're 200 pounds and they say, I want to be 112 pounds, we discuss, well, why do you want to be 112 pounds? When was the last time you were 112 pounds? And if I see that they're doing well and losing weight, and they're never satisfied, we start to talk about body image, and they may need professional help in terms of, reorienting themselves as to, why they want to be a certain weight. So that does fall into it. And some people also think, well, I'm depressed now because of my weight. I'll lose weight and I won't be depressed anymore. We know from literature from bariatric surgery that the weight loss is not a treatment for depression.
Right.
You may feel better about certain things, but if there was depression before, the weight loss isn't going to cure the depression. Your second part, maybe you weren't here during this part of the discussion, we did address that for most people, these are medications for life, because they are really supplying a signal that wasn't there just because of the neuronal network. And once you stop using the medication, things are most likely going to revert back. Now, again, that is not for everyone. Let's say, with the use of these drugs, you start getting nutritional education and you learn that, 10 bottles of Coke a day, that's not a good thing. Or you start to feel better and you start exercising. And then you sort of develop these new habits. Maybe you can come off the medication, but that is really in minority of patients.
Thank you so much. This has been incredibly, I was at the beginning, but I got a little confused about the duration of the medication for your whole life, because I don't know that people know what the side effects are going to be for that for a whole life.
Right.
So.
Well, I'm glad then you brought it up to clarify it, because it's a very, very, very important point.
Thank you.
Thank you, Ronnie. Those are great points, and thank you, Dr. Korner. Kat, do we have others? I know we're getting to the end of the show, so I didn't know whether we had others waiting.
We're going to wrap it up with Dear Mr. John.
Okay.
And then you don't have any more questions you have to answer.
Okay. John, what do we have?
Thank you. Yeah, this has been so interesting. So, Dr. Korner, I've got a lot of friends who are on these GLP-1s. They rave about them. I mean, they're just so happy and they look really great. But I'm so worried about still the long-term effects. And I'm wondering, how long is it going to take before we really feel more comfortable that there are not long-term effects? How long does that take in a case like this? And how do doctors feel during this interim period?
Yeah. So to put it in perspective a little bit, we have to remember that these medications first came out as medications to treat people with diabetes. Okay. So the initial type of medication in this class came out in around 2005. So over time, they started to be used just for weight loss, and we've come up with better medications. So we do have like an almost 20-year history with millions and millions of people using them. I think if there were like something really profoundly negative about them, we would have seen that. But if there is something very rare, so for example, recently there has been an eye condition that was found that these medications do put you at risk for this eye condition, but it occurs in about 1 in maybe every 200,000 people. Okay. So it's something that, you're not going to see readily. Now, do we know what will happen if you're on the medication for 30 years? We don't. But I'm just going to push back a little bit, John, because there are a lot of medications out there. And if a doctor puts you on a medication for, let's say, cholesterol or blood pressure, society has not said, well, really, do I have to be on this medication for the rest of my life? How do I know, that in 30 years, this is going to be bad for me? We generally don't ask those questions as a society. And I think it's because we don't take obesity as seriously as a disease like we take other things. And we're putting the threshold very, very, very high, for obesity medications. I think we have to look at the data, and really there are very clear known risks of obesity versus, I don't know, something might happen if I take this medication for 30 years. You have to balance that.
That's a good way to put it. So related to the point you just made, that obesity is a serious health issue, you mentioned earlier that Medicaid does not cover weight loss medication. Given that these seem to not be mere cosmetic applications, should Medicaid cover these?
Yeah, definitely. There is, though, the economics of it, and that is a big issue, because, if at the current rate that, cost, you will see estimates that if all the people who could be on these medications took the medications, you would bankrupt the system. So I think, why does this medication, cost $1,200 a month in the United States, whereas in Europe you can get it for $180 a month? So there's a lot behind the scenes that needs to be addressed. The economics are really very complex. My hope is that as more medications come up and there are more pharmacies, more companies make it, that competition will help. But absolutely, yes, it's very frustrating. It's like, if someone has coronary artery disease, they should be on a statin. To tell them, I can't prescribe this for you because it's not covered, that's horrifying. And that's what we're doing with the obesity medications. It's very sad.
John, thank you for bringing that point up, because I think that's a really important issue, because of Medicaid and covering this, because if you cover this and you get their obesity under control, then all the other medical conditions will cost, in the long run, will start to cost less. So it is really an important point. So thank you. And thank you, Dr. Korner. You have provided incredibly valuable information about these new obesity medications, but in general, the whole issue about obesity and management of weight loss and diet. So I am sure our subscribers are thrilled to hear your perspective on all this. But that is our show for today. So next time on Docology, we're going to hear from Kevin Griffiths. He's the former communication director for the CDC, on the situation in our nation's leading public health agency. And there are many things that are happening down there that we read about in the paper every day. But remember, if you are a Docology subscriber, you can join the show. You just have to click on the link in the bio. And I would say tune in next time, because the topic we cover may just save your life.
Docology's production of Hang Media. Our producer is Catherine Warren. Ronnie Zelig is our editorial advisor. Our creative director is Anna Richard. Janine Wilson of Wilson Media Group handles paid marketing. Our publicists are Leslie Ann Wade and Jerry Carapoli. And our executive producer is John Clark. Theme music was composed by Nick Chitz. Subscribe and join our community at docology.life. Until next time, exercise, wash your hands, and stay healthy.